are in listen-only mode.
Well, hello and welcome to today's HIPAA Chat. I'm Carol Fly with High Tech Answers. Thanks for joining us today on a Friday morning. Our guest today is going to be Lee Kim. She's Director of Privacy and Security for HIMSS North America, and we are going to be talking about cyber security. So we're very happy to have her on board today. HIPAA Chat is sponsored by eFax Corporate, which is a brand of J2 Cloud Services. They've been in the space a long time and actually have a number of products that deal with security of email and faxing. So check them out at enterprise.efax.com. Without their support, there would be no HIPAA Chat. You can actually join in the conversation as well on LinkedIn. We have a new group up there called HIPAA Chat. And if you go to LinkedIn and search on groups, you'll see it immediately. It's HIPAA Chat. You can pose a question there. Steve will get back to you. And our goal is to engage conversations around talks related to HIPAA, breaches, cybersecurity, and all the things that we sort of address on our monthly broadcast. And of course, HIPAA Chat is hosted by Steve Spearman, who's the founder of Health Security Solutions. Steve's been in the space for quite a while and is a recognizable face and voice in HIPAA and all things HIPAA that we talk about.
And I'm your humble servant.
And a humble servant.
I'm your humble servant.
Please check. He does a series of monthly webinars that you can check out at healthsecuritysolutions.eventbrite.com. If we don't get to a question, or even if you have a question that's related to HIPAA and security, contact him directly at spearman@healthsecuritysolutions.com. He is the Batman.
And as many people will tell you, I will get back to you.
He does respond.
A lot of questions. Yes.
He does respond. He is the Batman to my Robin. I just am along for the ride here to pose questions from our registrants. But if you're new to HIPAA Chat, welcome aboard. And if
you're demoting yourself to sidekick status.
I'm demoting myself to sidekick. Well, I thought Robin was kind of cool.
Yeah,
those that yellow cape. And of course. We're here every month. If you're a regular HIPAA Chat, you know the process. This is really a few slides and then a Q&A program. We really want to spend most of our time addressing your questions. Steve, we actually took the month of June off. Had a little bit of a summer break, but we're back, and I think it's just like riding a bike, isn't it?
Yeah, I think so. I think I'll be able to pop right back in here. Yeah. So we'll see though.
Oh well, yeah. You could do this. You could do this in your sleep. So I'm going to go ahead and introduce our special guest for today. We're very excited to have Lee Kim with us. She's the Director of Privacy and Security for HIMSS North America. She has obviously you can tell from her bio, a sort of a deep background in this space, and she's a published author with e-commerce law and policy. She's an attorney. She's worked in the healthcare and IT industry for quite a while, and is an intellectual property attorney in private practice. So Lee, I think the HIMSS director position, that's a part-time gig, right?
No, I am a licensed attorney, but this is full-time for me. So I am a non-practicing but licensed attorney, so I essentially apply all that experience and background to what I do. So HIMSS, I'm totally 100% HIMSS.
Well, yeah. I first met you a year ago at their privacy and security forum in San Diego, and so I think they are very lucky to have you.
Well, and I met Lee. I actually I can't even remember why, Lee. Maybe you do, but I ended up, I guess a year and a half ago or so, reaching out to Lee, and I just appreciated both her intelligence, breadth of knowledge, and her accessibility. I mean, when I emailed her, she replied back within the day, and we talked on the phone, and now we're both on the HIMSS Risk Assessment Working Group, which, of course, Lee helps lead, and so yeah, and it's been such a pleasure, getting to know Lee, and she's a fantastic resource.
Yeah. And
So
we're
yeah, HIMSS is lucky to have you. That's all we're saying.
yeah, that's all we're
saying.
saying. That's all we're saying.
That's wonderful. Thank you.
And before we start taking some questions from the audience, we're going to go over a couple things because HIMSS recently conducted a cybersecurity survey, and I know Kim, Lee, you wanted to talk a little bit about the results of that survey and what that survey sort of highlighted and some key findings. So if you could go ahead and just fill our audience in on the survey, and then we'll start taking questions from our audience.
Absolutely. Thank you very much for the opportunity. So before I start substantively with these slides, I just wanted to emphasize that the information contained on these slides is derived from materials that are publicly available on our HIMSS website. The URL will appear on these slides in terms of the link to the survey's executive summary, infographic, and press release. There is also a full in-depth report that is available to our HIMSS members as well, but I will loop back to that point. But in any event, I wanted to set that background before I started on the content.
Okay.
So that said, here now in 2015, it's clear that healthcare is viewing cybersecurity very differently than in previous years, given widely reported breaches in our sector and also other sectors as well. So that said, the survey was focused on how cybersecurity has changed against that background. It's certainly something where we had several hundred people reply to our survey that do some kind of information security function at their organization. So these are hands-on folks, whether it's technical or perhaps they're involved day-to-day in terms of making information security policy for their organizations, or they're the managers, or they're the directors, or the CISOs, or the CIOs. In terms of key findings, here's the really good news, right? The healthcare organizations are saying that information security is indeed a business priority, and not only is it a business priority, but it's really increased as a business priority in their organization. So in terms of what that means, in terms of increasing as business priority, you'll see that, as their survey has found, there's more investment in technology. There are more people that are dedicated to information security at healthcare organizations, including full-time staff. So with regard to the technology, a lot of the respondents had responded that the improvements include improvements to network security, such as monitoring what's going on into the network, containing the incidents, eradicating them, doing the triage, doing a better job in terms of endpoint protection to secure devices and user IT computers and all else. Data loss prevention technology to prevent, for example, an end user sending PHI or PII or other sensitive information external to a place where you don't want it to go, for example, their personal email account or to social media. That software technology, excuse me, is designed to block and prevent that with adequate configuration. Improvements also include, and this is good news, disaster recovery and IT continuity, two areas that, at least from what I've heard, what I've researched, in my past experience, healthcare organizations have lagged behind other critical infrastructure sectors with regard to DR and IT continuity efforts. But this is good news because regardless of why your IT systems excuse me, are disrupted, you'll hopefully have a written plan in place and technologies as well as processes in order to restore that data in the event of a man-made or natural disaster, man-made disasters including even cyber attacks. And you also have an IT continuity plan so that in the face of something abnormal happening, such as a man-made or natural disaster, you have a plan and processes and people that know what to do in case you do need to switch over to alternate sites or alternate equipment, and get personnel and processes and technology engaged in terms of your contingency or backup plan in case something does happen. So why the new emphasis on information security? Motivators for folks that answered our survey included there's more malware happening, so they're motivated to have increased information security as a priority. Phishing, a lot of healthcare organizations are getting more targeted with phishing emails and even spear phishing. A lot of organizations are getting targeted, by very sophisticated people. It's not just simply, oh, I see that there's a typo in this email, and so therefore it's a phish. Motivators also include, for increasing information security as priority, risk assessment results. And perhaps not unsignificantly, over 2/3 of people had reported having a very significant security incident. So in terms of the ability to protect IT infrastructure and data, though, this included in terms of level of confidence of healthcare organizations have reported an average ability to protect their IT infrastructure and data. And so it's not especially strong, but I think that the good news, the general message that we have from our survey is that on the whole, the technology measures, the measures with personnel and the plans and the processes have generally improved. Because we're definitely dealing with an environment where it's very challenging in terms of the cyber attacks and other losses that our organization is facing. So that said, in terms of key findings, how are people literally bolstering their infrastructure to stay ahead of the threat? They're layering technologies such as antivirus software, which certainly is helpful in terms of threats which are, or I should say antivirus or virus definitions that are known. They certainly use firewall, which is obviously a good measure. They're also implementing data encryption at rest and in motion to make sure that the information is protected and hopefully secure end-to-end. In terms of how security incidents are detected by healthcare organizations, generally detected by healthcare organizations' internal team, according to our survey. And in terms of what kind of incidents were detected, they include the people that write the phishing emails, the people that work very hard, unfortunately on the other side in terms of the adversary, in terms of social engineers to try to get sensitive information from you or about your patients or about your organization. Hackers who are certainly part of the external threat, nation-state actors or people that are part of organized crime groups which are often aligned with nation-state actors, affiliated with enemy foreign governments. They're certainly part of the threat and part of whom our respondents claimed to have originated these security incidents that they had detected. And some of our respondents also experienced hacktivist activities as well. That is, hackers that are motivated by political or sociological, ideological concerns, and therefore they try to disrupt or otherwise harm IT data infrastructure or availability. So that said, at the bottom here of the slide is the link to get to our publicly available materials, which I had culled the data points from. And as mentioned, our executive survey and infographic and news release are all publicly available. So you can certainly access those using the hyperlink that's there. And finally, for those of you that would like to see the full report, or even a slide presentation which we have in an in-depth analysis of the survey. If you aren't already a HIMSS member, you can sign up for membership. And just as a FYI for folks on the line, the URL to do so, if you're so interested, is www.hims.org/membership.
And for those listening as well, the executive summary that Lee just talked about is also available at hims.org/2015/cybersecurity-survey. It's actually 2015-cybersecurity-survey.
Hey Lee, I have a question for you. It's sort of surprising to be here in noting that apparently one of the actors that it seems like I think there's confirmation on is China as an example. And is there, so at least one of the things you've read in the press is that China was apparently the actor in the Anthem breach. Is that confirmed? And if so, you know, do we have any sense of what the motivation is in those cases?
So in terms of whether it's been confirmed, what you're reading, Steve, is exactly what I've been reading. I've seen that China is suspected, but in terms of more substantive evidence, at the level where I'm at, I unfortunately don't know. But let's go to the more interesting question, at least, which is, okay, why are they doing this? What's going on? What's at play? So, one of the things that's going on today, unfortunately, in terms of these cyber attacks that are being fueled by these nation-state actors, is that it's all part of there are always dynamics that we don't see, right? Information that we might not have access to. But if you look at things in terms of just a broad picture of where we are in terms of our world, certainly the battles traditionally that we would have fought on the ground, a lot of the battles are, at least if you read what you see in open source, such as in the news reports, they're being waged in cyberspace. So unfortunately, the private sector has had to deal with some of those results, I suppose you can say. And so, one of the questions that one would ask in terms of analyzing these things with that in mind, knowing that, okay, maybe there's a political reason that this is happening, maybe the nation-state actors may want certain types of information from our organizations. The next layer of analysis, I believe, is looking at the motivators, right? What are these folks after? So what I have read in terms of my research in open source is that nation-state actors from China seem to be traditionally after intellectual property. And as an intellectual property attorney, I could say intellectual property broadly includes copyrights, patents, trademarks, trade secrets, and confidential know-how. But most often what we hear about supposedly China being after are trade secrets of organizations. That is, secrets which generally are not known to the general public, which essentially give the organization a competitive edge. So that's certainly one possibility. So, one might think, oh, I'm an academic medical institution. Maybe they're after my research information, which, that may be possible. Another thing as well is that you also have to look at the big picture and realize that, other countries too are, maybe looking at, for example, how do we do things in terms of, how we make our healthcare organizations work in delivering really superior patient care. So to the extent that it's available, and since we're so highly dependent upon storing things in, electronic media, it could be that essentially the adversaries are after information such as our confidential know-how, which describes in writing how we actually make our healthcare organizations work to deliver effective patient care. So all this is, certainly possibilities for, what the nation-state actors may be after, but I think that it's safe to say that we in the healthcare sector are not alone. It's not just simply a healthcare problem, right? The electrical sector and other sectors are indeed under attack. So it's, Steve, you may want to, build upon this point, but I'm always a fan of, if you're trying to secure your information, you have to know exactly what you have and the value of it and how much you want to protect it, including your sensitive information for your organization and your patients. And regardless of what the motivations are, regardless if it's nation-state actors or a rogue employee or otherwise, the threats will always be there, and it's not just simply an adversary that may be, working for a foreign government or another, government that perhaps has adverse interest to ours. So that's my take on it.
Yes, because for a lot of people out there, it's about money. I mean, there's data has value, and healthcare data apparently has more value than, for example, credit card data. So it's interesting to consider those issues. But so let's I guess let's hop into hop into it. So
Steve, Lee, you ready to dive right in?
Yeah, let's dive in.
Yep.
So I'm gonna got a host of questions from the people who actually registered, and if for those of you attending live, if you have a question as well, please use the question box found on the right side of the webinar dashboard under questions versus the chat function. That would be great. I'm going to start with a sort of really a high-level question from Patricia from North Carolina. With all the hacking into major systems going on nowadays, is there really any such thing as cybersecurity? Emphasis on, of course, the word security.
Lee, I'm going to let you take it on quickly, and then I'm going to just kind of add my piece on that.
Yeah, most definitely. So, here's my take on it. Yes, we need to do as much as we can to make our system secure. Since all that we have really is defense as opposed to cyber offensive maneuver, you're correct in that it's very difficult to be right 100% of the time and block and prevent all the threats that are coming at us. But instead, best way to go is to be really proactive and vigilant with training people to do the right thing and to have security awareness, and also to have your plans in place in terms of the detect, contain, and respond to the threats as well. So you really need to address the full spectrum. Otherwise, if the barn door is open wide, then you'll have a lot bigger of a breach than the barn door that's maybe just a little bit open that you can slam shut again and maybe put a better lock on it. So,
yeah.
Steve?
Yeah, I mean, and exactly. I will say this, that like a lot of information security specialists, I am pessimistic about protecting against a targeted, what's called a targeted persistent attack. There are so many vectors, and and you can, and you have to protect the human and the technical and all that sort of thing. But to the point that Lee made is, one is that everybody's heard the joke that two guys out in the woods and bears coming their way, and one of them's running, the other one's putting his shoes on. He said, and he says, I don't have to outrun the bear, I just have to outrun you. And the point being is that is that you have to be diligent, because you want to be persistent and do enough that maybe they're going to go on to the next target. Like I said, it's exceedingly difficult to to protect against if you've got a targeted persistent attack. Which leads me to another point, which is, as an information security specialist, who really, my specialty really in many ways is about the practical application of HIPAA. I want to see what's going to happen when a case is adjudicated before an administrative law judge of the Office of Civil Rights, where there is a hack that's occurred where the organization was doing everything right. Recent risk analysis, policies and procedures in place, documentation to prove that those policies were being followed, etc. Because even though I'm not super optimistic, I mean, it's hard to defend against that kind of attack, but I would like to see a case adjudicated where the government does determine it was what's called reasonable cause under the rules. And so, for me, it's like I come back to, like, as you said, it's keeping the barn door shut, and you do that by doing what you need to do. I mean, what what's compliance requires, and so it's thinking about, it's not, I don't think we throw up our hands and say, well, it can't be fixed, there's nothing we can do, but you need to do enough, and you need to do what's required under the rules. And I think that you're seeing an increased conscientiousness about being aware of what needs to be done through the efforts of groups like HIMSS, and all through the sheer newsworthiness of some of the more recent breaches. So it's an interesting question, and I guess my ultimate answer is keep the faith, do what you have to do the best you can, and and certainly get your regulatory house in order. Make sure that you're doing what the regulations require. So.
Okay. Next question is from Ed from Florida. What do you think a covered entity should be asking for, i.e. reports, etc., to successfully monitor third-party security?
I'll take a quick stab at this, and here let's see what Lee has to add to it. First of all, the main thing is you have to, as you know, third-party security, we're really talking about in healthcare business associates. So those are, under the rules, a business associate is any contractor or vendor who, under the terms of that, of an agreement, has to process, view, manage, transmit, store protected health information. And the minimal requirement is that they have to sign a business associates agreement, and when they do that, they are basically agreeing they're going to comply. Now, the degree of oversight is something about which there's some controversy, and some of you that have been on the program before have heard me talk about this, because there's some tension between oversight and agency. In the law, and this especially came out in the omnibus update, is that if a covered entity were to show we're basically to manage a business associate in such a way as to directly require certain policies and other things like that, it could actually increase the liability of the covered entity under the principle of agency. But in contrast to that is, like, how much should you know? How much should you know about your business associates, is a good question. My answer needs A, up-to-date business associates agreement, B, annually having them affirm that, that they are, following the regulations, and C, that they're getting training. And beyond that, it's not real clear. Lee, I'm actually curious, what are you seeing the larger enterprises do as it relates to that?
So let me speak from my past experience, Steve, in terms of what I've seen large enterprises do, in their agreements generally, which is to say, in terms of that annual review of what the organizations are doing, they may require the right to review the SOC 2 report if the organization is regularly audited against that standard. But for those of you that have read through a SOC 2 report, what it's maybe 20-some pages, and does it really tell you in depth? Okay, how deep are their backups? How are they really securely destroying their media, et cetera, et cetera. So those are just some examples. But you know, that said, I think that it's a relatively easy ask to say, let me see yearly your SOC 2 reports if your data center or wherever is independently audited by auditors. What else I would do as well is there are certainly some organizations that send over or have meetings or face-to-face or virtually with key personnel where they'll regularly ask questions about the security program and how things are going from a technical perspective, and so the Q&A is generally something that's done if, for example, the organization is not willing to just send to you, which would kind of be a rare occurrence, I think, in terms of the results of that risk assessment, which a lot of organizations don't do because some fear that it may be a roadmap into what kind of vulnerabilities they might actually have. So, Steve, if you have any insight or perspectives into whether you've done that or whether you've heard colleagues doing that in terms of asking questions about security programs on a regular basis in terms of risk assessment results, like handed over, I'd be interested.
I mean, I would have the same concerns that a lot of vendors would have. It's like, yeah, I mean, I think it does sort of present a roadmap. I think that I've actually helped some organization create what I call a statement of compliance. I've done this for a few business associates where I had done their work, but I said, generally you don't want to just give your risk analysis to anyone for the reason that that Lee just mentioned, and then and it's sort of an affirmation around training and policies and that they've conducted annual risk analysis, et cetera. I think one of the concerns here is that it's unfortunate but true that many vendors, for them, that business associates agreement is a marketing thing. It's not actually, they do it because this is what we have to do to get the business. And I think, too many of business associates don't really take it seriously enough. And I think it's gotten better in the last year, but I still think it's a concern. And
That's right.
It's not clear kind of what the best course of action is. I'm actually curious, Lee, whether you've run into this kind of agency versus oversight issue at all, because I do think it's you can do too much. If you end up playing a role where you're effectively managing your vendor, then it could be a problem.
So for the folks on the line that are listening, Steve is absolutely right. In the HIPAA Omnibus rule, which we're now under in terms of our privacy and security rule and breach notification rule obligations, if you were to pull up that final rule, they use the phrase federal common law of agency. And so essentially, if you fall within the ambit of federal common law of agency in the sense that, for example, you are a covered entity and your business associate is deemed to be an agent of yours because, let's say, for example, and just piggybacking upon what Steve had said, if you were to specifically direct, for example, prescriptively what you should do for what they should do rather in terms of their security program or processes, there is some chance that you may be viewed as an agent of the covered entity. And so just as an example, in terms of what a quote-unquote agent is from that vantage point, an employee, for example, as an agent of their organization. So as a result, I believe that the government has said in the final rule that the covered entity may even be subject to penalties should that business associate, in that case, under the federal common law of agency, be out of compliance and there's some kind of problem. I can say that for folks that are interested in understanding more about what the government actually interprets federal common law of agency to be and how much hands-off or you need to be, I would suggest folks to call their local Office of Civil Rights office and ask them, because they have attorneys on staff whose role it is to educate and inform folks and give technical guidance as to these HIPAA rules. And I would think that that would be a really excellent question to ask. When I joined HIMSS, I remember that the omnibus rule was just taking effect. So while from a practical perspective, I haven't encountered that in practice as a result of that timing. I could say that your best bet would be to call OCR for guidance. They're there literally to help you and to guide you with issues that may come up in terms of HIPAA in addition to enforcing the rule.
Yeah, and it's gripping topics like federal rules of agency that draw people to HIPAA Chat every month. It's but actually I wasn't aware that OCR actually had those sort of resources. I don't know if we could, after as one of our follow-up items, maybe give a little people direction on that.
Yeah. Also, when I send an email out with the recording and the slide deck, I'll include a link to OCR. So that'd be great. That's great. It's sort of just skipping around here a little bit, but Carl from Florida, what do you feel is behind the hesitation in some practices in not transitioning to secure email service? I don't know why they'd hesitate, but
well, I think in some cases it's just how they're using email. I mean, I've told clients and I only say this in cases where it's actually realistic. Like if I go into a clinic and they've got 48 doctors and 250 employees, and they say they don't use email to send protected health information, I just don't believe it. I'm not saying they're being insincere. I just think that for large organizations, people really depend on email. But in a small clinic setting, it's not unrealistic that you could establish a policy that disallows the use of email to send protected health information. And so sometimes it's misinformation. People just don't understand kind of what the rules are. Another situation that I run into is where they say, well, we send PHI, but we have our own Exchange server and we only do it, internally. And the problem with that is that it's just not how people operate in real life. It's like if you're in the cubicle next over to me and I send you an email and it has a spreadsheet with 100 records with protected health information because your policies will allow you to do it or whatever, and then the next moment you need to send maybe the same spreadsheet or something to Joe across town at the PA. People don't tend to segregate things that way. They don't tend to think, well, this I can't send and this I can. So then I think technical solutions for secure messaging email becomes really important. And so a lot of it's education, culture, not really understanding kind of what the rules require.
Right.
Lee, what do you think?
Absolutely, Steve. Thinking back to my experience with healthcare organizations from a practical perspective, and I could say that it certainly was the case that healthcare organizations just may not simply be aware that email inherently is not secure. And they might not be also aware that there are secure email solutions out there that are the classic secure end-to-end solution where only the sender and recipient are able to see the message.
Right.
Yeah, no one can intercept it or modify the content or, whatever have you. And so, to me, when I was in the position of crafting policies for folks, or maybe even giving specific guidance on secure email solutions, sometimes it was just as simple as pointing a few, tried and true providers to them, and just saying, no, trust me, email in itself is not secure, but there are solutions out there that, unlike, gosh, I've been on the internet for over 25 years, and I could say that certainly we had secure end-to-end email then, but not naming the technology, it was a little bit of a bear to use. You had to be a true techie. But now we have many solutions that are seamless, which can be integrated and that might not necessarily cost much. Steve, what do you think?
Yeah, no, and I think actually that you touched on maybe the most important issue. I mean, a lot of times people think that it's going to be a hassle, and yet they work pretty well. And actually have a customer, a good customer, and that has a solution that is indeed kind of a hassle. You have to put in your password for every email you get. It takes the email and it actually puts it in an encrypted PDF, and then you have to put in a code each time. That's a hassle. And I think that looking at is one thing I say a lot is looking at the trade-offs between security and usability is actually really important, and maybe especially so in healthcare. So, but there are solutions that once you've done, based on your email, you've done an initial authentication into a system. So, like Barracuda and Zix and Proofpoint, eFax all provide sort of much more seamless sorts of email solutions, and those I think are, many more organizations should be looking at that because they're pretty painless to use, and so I do think that just generally for the two big concerns that constrain a lot of people taking these things on are money and for a lot of them it's just efficiency, just afraid that it's going to slow them down, and it really has gotten much better. So,
yeah. And a quick plug for our
eFax, of course. Yay, eFax.
eFax. I mean, don't let the fax.
It should be,
it's not just faxing,
eFax / mail.
And
eFax
email.
mail.
Yeah. They have a great product that does secure email. So please check them out. Annette from Georgia wants to know, how has the level of security from mobile devices used by providers been addressed recently, internal versus external use?
I wasn't exactly sure with that internal external, but I think that it might be getting at the issue of personally owned, versus corporately owned, and
that's how I would read it.
I think so. I think that you're seeing a lot wider adoption of mobile device management solutions that can address that. And you can with those solutions you can ascribe a different set of policies for corporately owned versus personally owned devices, and there are solutions that are definitely worth looking at. I think the dilemma for a lot of people is that on the one hand, having people use their own devices can save an enterprise money because it's their own device, but what happens is that people using their own device, even that's being used to process PHI or otherwise access via email or otherwise access PHI, they want to be able to use their device however they want to use it. They want to be unconstrained in its use, and you just can't do it. You can't. It's one of those, like, you got to either choose not to use it or be willing to have it constrained in its use. And I think the mobile device management can help kind of bridge that gap. Those solutions are and they're pretty sophisticated, even to the degree that you can have functionality that it's called geofencing, where certain capabilities like the camera on your phone will disable once you walk into the hospital doors. And now that's, again, you have to think about trade-offs because a camera can be useful in certain clinical, so you have to think about it, but that's really where you're seeing those kinds of
Yeah,
solutions.
and I guess it's worth noting that even though the listener framed this in the context of mobile devices, really what we're talking about is media devices, right? Our smartphones, our tablets, our
Yes,
right,
yes,
right.
yeah.
It's really
Not just laptops. Yeah,
not just portable media
yeah.
devices, right?
Portable
Right.
media. Yeah, absolutely. So.
Melissa from Florida, on several blogs I've read mention that only the ONC, that's the Office of National Coordinator, only the ONC's SRA, Security Risk Analysis form, is the one the auditors are passing. Is this true? Steve, you get this question. We get this question, I
We
think,
get
almost
this question. Okay.
every HIPAA
First of all,
chat. Yeah.
no, it's not true. It is not true.
It's not true.
That whole it must be true. I read it on the internet. No, it's not true. And Lee, you'll have to pardon me because you're going to hear a bias of mine. Okay, I am not a fan of that tool. It's like if it were true, it would be a travesty because it's a tool that's too difficult to use to get a result that doesn't actually really, in my opinion, meet the regulation as it's defined. I mean, I think it could be improved, and and actually, I mean, the tool that I point people to is the HIMSS. If you're gonna, I have reservations about self-use tools just all around, but if I'm gonna point people to one, it'll be the HIMSS tool, and it is doing a better job of integrating, for example, the inventory in with the the security attributes that are going to be important for enforcing security. And Lee, I'm sorry for giving such a stark opinion. I think you knew that already. Maybe you've heard me talk about that on some of our risk assessment working group things. I'm not a fan of the tool, and I can say the reason I can say it's not true is because I've had now many of my clients go through meaningful use audits, and a handful go through OCR audits, and I don't use that tool. So
Since we're talking about, sorry, go ahead.
Oh, I'm sorry.
Go ahead, Lee.
Steve, I was just wondering if you heard anything in terms of an update to that tool. I can say that we at HIMSS, through our HIMSS Privacy and Security Committee, we actually reviewed the application itself when it first came out, version 1.0. I think it was available, for the public to download, and we at least recommended some improvements to that tool. But I was just wondering if you heard of anything in terms of an update to that, because as with everything, I suppose what you're saying is, it would be good to hear if there's been an update. I have not heard anything yet.
I haven't either. I mean, I've downloaded it off of the website as recently as maybe about 3 months ago, and it was the original, was the one that I downloaded a year and a half ago or whenever it was released. So as far as I know, it's not been updated, and I've not heard of any plans to update it. So.
And I'm assuming you can search on it, right? If you go to the HIMSS.org website and search.
Yeah, you can actually search on HIMSS Security Risk Analysis Toolkit. I think will get you right. And one of the things I appreciate about that tool is you do not have to be a member of HIMSS to use it. It's available to everybody, and it's a spreadsheet. The other tool that I will recommend sometimes is from the National Learning Consortium. It's also a spreadsheet, and but like one of the complaints I have about some of these tools is that a lot of them, including the ONC tools, built on the NIST guidelines, which are not binding on healthcare organizations. They are only binding on federal organizations, and so that's in the long article I wrote about it. I said it does too much and it does too little. It does too much because it's based on a standard that's actually not binding on non-federal organizations, and it does too little in that, in my opinion, it doesn't actually help them do what is required. So, however, having said that, it is a tool that's been released by the government, and if it were used in good faith, and thoroughly as designed, it would be kind of awkward for the government to say, "Oh, you failed your audit." So,
Right.
I feel like that as a tool, for meaningful use purposes, I think, it shows maybe what, would be, but I really do think that if you were to go through a real HIPAA audit from the Office of Civil Rights, and I'm not sure it would pass. I mean, maybe that's, it's hard to say, but so anyway, everybody that's regular attenders, they know my opinion on these issues.
Yeah. Since we're talking about MU, can you clarify? Is a question actually from one of the attendees in the Q&A box. Can you clarify what the stage 2 requirement is regarding encryption of EPHI?
Yeah, I can. So first of all, there was a lot of confusion when stage 2 was published. It's saying, oh, you have to encrypt. But if you go and look at the actual language, and first of all, the language around encrypted that was adding stage 2 was added to the security. It was actually added as an addendum to the same language regarding risk analysis. And what's really apparent is that because it actually adds language that references the administrative, like 306 administrative standards, where it talks about addressability and other references. It's clear that they're not changing the standard. Encryption in the 2 places that it's mentioned in the regulations is still an addressable safeguard, and that where there is sort of a binding requirement is on the certification of electronic health records. The stage 2 to get certified, you had to, the data in the databases had to be encrypted as a default, and only an administrator. You had to, code it such that only an administrator could disable encryption. It couldn't be done just by a standard user, things like that. And so it doesn't change the standard. Encryption is still addressable, but one thing to remember is that there are all kinds of the writings on the wall. The government believes more people need to be encrypting. They get granted safe harbor for, under the breach notification for encrypted devices. And my main thing is that, I go through this process with my clients of helping them identify, I call it the encryption analysis, where we look at it. If you've got data, let me just sort of put it out there. If you've got data on mobile devices, laptops, and PHI is either being cached or stored locally, even though it's addressable, let's just say it's required. Just on this show today, we're saying you
right now
really need to do this, because the risks are too high. It's like, but regardless, any kind of addressable safeguard, you have to document when you choose not to implement an addressable safeguard, and that needs to be, you need to demonstrate, why. So there are many settings where where I think it's reasonable and appropriate, like in a case where if encrypting the databases of servers that are in a secure data center, where by encrypting it you are the performance of the software, the latency increases by 5-fold, where that's certainly good documentation that would show due diligence, that would warrant a decision to say it wasn't reasonable and appropriate.
Sort of a question from one of our registrants, and it's sort of along the same subject lines. So how would you recommend we document assurance that our risk analysis assess the effectiveness of encryption with our certified EHR system?
Lee, you want to take that one?
Sure. In terms of the documentation requirement, the regulations state that you really want to ensure that you're documenting the reasons why you believe that encryption is sufficient, let's say within your EHR or another place to safeguard your healthcare information. Document how you came to that conclusion that it is a reasonable and appropriate measure for your organization. And also, Steve, to piggyback on your previous point as well, in terms of how there is seemingly a push, seemingly, or at least seems to be a favorable view by some, that encryption is just simply a good thing. You also need to document where you aren't encrypting. So, let's think a little bit out of the box and not just simply EHR. A lot of HIPAA and PII information is located in many places outside of that EHR software system kind of context.
Mm-hmm.
So you also need to document the areas in which you are encrypting or even not encrypting and the reasons why, and to the extent that you are encrypting that, let's say it's a FIPS 140-2 certified module, or it's an encryption that algorithm which has been recommended by NIST as something sufficiently strong, that there is indeed, as you verified, good key management. Because a lot of folks, and Steve, I would love your input on this, a lot of folks think that, oh, it's encrypted, I'm good, and then it's totally hands off. But really, there's a lot more to good encryption than just simply saying it's encrypted, because we've seen things which shouldn't happen, such as encryption keys being hard-coded in source code, or maybe it's in a place where others can get access to it, or maybe you're using weak encryption that can be cracked using the tools that are out there. But Steve, what are your thoughts?
Yeah, I mean, like, so, you know, when it comes to encryption, there are a lot of factors. Like, I mean, yes, you need to, you know, are your you know, keys in clear text is a definite issue that, you know, they should be hashed and not accessible, and that, you know, gets in a number of factors. Key management, just generally, it's like for you know, one of the things that you know, of course, oh, I've forgotten the name of it. What's the open source encryption that's no longer really, what was the name of it?
The open
TrueCrypt,
SSL,
yeah.
are you talking about Heartbleed?
TrueCrypt, yeah, TrueCrypt. So
Oh, okay.
TrueCrypt, you know, is an open source system now no longer being supported. People are trying to do a fork of it. But, you know, one of the things I said, yeah, the encryption is good, but it's like if you've got an enterprise, key management becomes a huge issue. I mean, you know, there's potential that if you lose a key, you may be out of HIPAA compliance because you lose data that, you know, that, well, and generally it would be more like, you know, medical record retention, but still, you know, so there are a lot of factors that go in to determine that. I mean, and one of the things, I mean, one of the ways that I push clients is, one reason I'm a huge fan of thin client devices, huge fan, is because you can't put data on it. You can't, it has an complete incapability of having data stored or cached locally, and that would mitigate the need to encrypt those client devices, you know. So there are alternatives that are, I think, can present better trade-offs than encrypting, you know, laptops and things like that. But, you know, so you have to kind of go through and consider, you know, the different factors that, you know, that affect that. But, you know, one thing you said, Lee, was like everything that's not encrypted. I mean, even copy machines or something, you know, you know, I'm not saying to everybody that's listening that you need to be encrypting the drives on your copy machines, but you should be documenting, you know what you have done, and make sure that when you get rid of it that you properly dispose of it. So anyway, you got to look at everything.
Yeah, well, believe it or not, we are just about ready to wrap up here. We have a lot of questions coming in from our attendees today. Please reach out to Steve or Lee directly.
Can we answer one more? Let's ask one more. I'm having fun.
You want to ask one more? Okay, all right.
Quick.
Quick.
Can you do two? Well, yeah. Okay. We'll do
all right.
one more.
How about this one? All right. What do you think about yearly background screens for your contractors and your vendors?
You mean I wonder if they're asking about employees of those vendors. We kind of sort of touched on that one in a lot of ways through that.
Okay. Well, how about this? Is there a secure way to communicate through email as a company and discuss consumer care using PHI without well, we've actually covered that already. Let's see here. If an organization's EHR system is cloud-based and the network is set up as a work group, is this a compliance issue?
No, it's not. And basically, let me kind of say that compliant, I mean, I would, in some ways, I'd love to know if you were the person out there and I pose that question, please email. I'd like to understand maybe the genesis of the question, but what they mean by work group is as opposed to domain management using something like Active Directory. And Active Directory is great. It's a great tool. It allows you to centrally manage policies, security policies, but it's perfectly feasible to, for example, bring up a computer where you are staging it and you have a checklist where you're making sure everything's, defined properly, consistent with policies. I mean, and in fact, there's some situations where that may be even better than use of Active Directory because it's not free. I mean, so Active Directory can be helpful, and for organizations over a certain size, not using Active Directory becomes impractical. But it's not essential for security, in my opinion. Again, if you're the person that asked that question, you want to send me an elaboration on that. That would be good.
Bud from Mississippi. All right,
Okay.
we are all out of time. Thank you so much, Lee. We really appreciate your time today. And Steve, as always, I'll get the word out for next month's HIPAA Chat. And of course, to our audience, thanks so much for taking time today. Have a great weekend.
Thanks, Lee.
Thank you.
You are awesome.
Bye.
Likewise. Bye.